to people bringing iPads before. There's lots of little fun stuff you can do. So, how have you been since I've seen you last?
Not so bad, actually. Like, sometimes I feel pretty good and I can do stuff. Yeah. Especially when I wear my hose, which I need more of.
Now, do you do the thigh high or the
thighs?
Thigh.
Because the waist is too hard to get on and off.
Okay.
And the knee ones always cut me off under the knee.
Makes sense,
But the thigh ones, they don't last long. They get runners in them, or the plastic kind of goes. And,
I didn't realize that.
Then I gotta pull one up every time I'm walking and stuff.
I'm not sure how often we can replace those.
Yeah, I don't know.
I'm sure we could find out. I mean, it would be through your insurance how often they'll replace it.
Yeah, so sometimes I feel really good, and then I feel guilty about that sometimes because other people are like, "Oh, you don't seem like you're very sick," you know.
Oh, I can understand that though. You know, when people have an illness that you can't see from the outside, they don't understand it sometimes very well.
Yeah.
You shouldn't feel guilty. I think you should enjoy it. You deserve it to feel good on the days you feel good.
I think so,
because you've had some pretty crappy days.
That's true.
It's easy for me to say, hard for you to feel, but I would encourage you to enjoy it.
Then with, like I didn't wear hose one day, and I was doing a lot on my feet.
Yeah.
And then I ended up having a fluid problem, so I had to keep my feet up, and I took one of my fluid pills, and by the next day it was a lot better, because my legs were all swollen up, my feet and everything.
Yeah.
So I meant to bring that bottle in. It's kind of old for my cardiologist, but I still have some.
Is it like furosemide, Lasix, you think?
Mm-mm. Something different.
That's fine. Just let me know.
All right.
You just use it like as needed if you get really swollen days?
Yeah, I don't need it very often.
Let me see if I have it on your list. Don't think so.
Yeah, it's not something I take regularly.
I don't recognize anything that's a water pill, so just let me know the name of it.
Okay.
And we'll see if you need more.
Yeah, eventually I'm going to.
Sure. Sure.
So then I have questions about the COPD diagnosis.
Okay.
So could P.O.T.S have affected the pulmonary test? Because some of the symptoms with P.O.T.S are a lot of the same with COPD, the shortness of breath. And
well, I think the symptoms can overlap, yes, but I'm not aware that P.O.T.S would interfere with the results of the test. You know what I mean? I think maybe I'm not going to be able to answer that for you. I've never even thought about that. You know what I mean?
Because before she was diagnosed with the COPD, the symptoms of COPD, she already had that with P.O.T.S.
Yeah. Well, how long have you been a smoker?
More than half my life.
Yeah. What we're learning is that people who eventually develop COPD most of the time have been smokers, not always, most of the time.
Yeah.
And symptoms of COPD, which is usually shortness of breath is one of the first ones, can start sometimes 20 years before anybody's even diagnosed with with it, because they don't realize it. It's just so short-lived. Plus, if you've got another illness at the same time, sometimes you don't know what to attribute what to.
Right. I didn't realize that my breathing was so bad until, over the winter.
Well, we really didn't get prompted to look into it until you had the pneumonia, right?
Yeah.
Right.
So looking back, before you got sick with the pneumonia, were you having significant shortness of breath when you just exerted yourself most of the time, or was it even when you were at rest?
It's better when I take hawthorn berries, but it's always that way. Like, I can only do stuff for, like wrestling with my kid or dancing or something, about 60 to 90 seconds, and then I need to sit down and let my heart get normal and my breathing back.
I'm so sorry.
And sometimes flights of stairs take my breath away, sometimes it doesn't. It just depends on the day.
I'll be right back with you. Well, we haven't had you see a lung specialist yet, right?
Right. No,
I don't think I have. No, Dr. Blue came over. Thank you. No, thank you. I'm so sorry. Okay. So let's look at your pulmonary function test. We did that about a month ago.
I'm not sure it's been that long. At least 3 weeks, probably.
Yeah.
So that'll tell you what stage I'm at too, based on the numbers, right?
No, not always. Sometimes it's based on numbers. Also, mostly it's based on people's symptoms.
Oh.
And they're categorizing it a little differently now, and it used to be stage 1 and 2, and now it's A, B, C, and D. And it depends on how short of breath you are with activity, and whether or not you have things showing up on, CAT scans or X-rays. So.
But see, her O2 stat even today was 98.
Yeah. So I'm getting the feeling like you are not sure you really have COPD.
No, I'm sure that I probably do. I'm just hoping that it's like stage 1 or something.
No,
so
I hear what you're saying. I do.
It's not so
I think that's
bad.
a legitimate question. I really do. Because you want to know where you are. Is this something... So what we found is that most people don't get diagnosed until they're 40 or 50 because that's when they start getting a lot of symptoms or more symptoms. And the damage from COPD has been going on, or not damage, that's the wrong way to word it. The disease process has been going on for years before that, up to 20 years before. Dr. Wayne, our pulmonary doctor, said we need to start doing these tests on people in their 20s and 30s who are smokers, and then we can catch things early.
Right.
And hopefully stop the progression of it through quitting smoking and some of the meds. But you know, you have legitimate questions. Number one, if you have COPD, how severe is it? What can you expect? Yeah. What can we do about it? And does the P.O.T.S interfere with both the results of this test and does it complicate anything? You know what I mean, with COPD? Those are legitimate questions.
Plus asthma. I figure that's the least of my problems right now.
Yeah. Yeah.
But I was watching a video about it, and it says there's this thing called alpha-1 antitrypsin, and some people have a deficiency of that.
Yes. You know, I don't think that I've ever checked that for you.
No.
And we can. That's it. It's a blood test.
I'm going to do some lab today for my vitamin D
well, then I'll add it on. Yeah.
Okay.
Yeah. Yeah.
And then is there any other medicine I can do besides the Symbicort?
You mean inhalers?
Or is there...
So do you just have do you have an albuterol rescue inhaler right now?
I have one of those, plus I have the Symbicort. I've been using that every day, sometimes twice a day.
So the Symbicort is twice a day. It's a maintenance medication.
Yeah.
I think I started you on that after the pneumonia. Exactly, because I was thinking, and then after that we got the test, right? Correct. Yeah. Okay. So albuterol is that's your rescue inhaler. I call it a rescue inhaler. And it works
short term.
It does. It's like every 4 hours because it opens up your lungs and then it's kind of out of your system. The Symbicort is a longer acting one, and it's more of a maintenance.
It makes a difference for me.
And it's also got a steroid in it that's locally absorbed into your lungs, so the majority of it's just in your lungs. A very teeny tiny portion gets into the bloodstream. It's very minimal.
All right.
Symbicort can be used for both COPD and asthma, and has indication for both, so it's not just one or the other. But yes, if people have true, just plain old COPD, there are different inhalers that we can use. One of them is called Spiriva, one of them is called Tudorza. But the Symbicort kind of overlaps both. So
yeah, that one seems to work good for me. I just wondered if there was any kind of pill or anything, too.
She doesn't like the...
Oh, the inhaler part of it?
It makes me almost gag sometimes.
Bless your heart.
The nausea.
Afterwards.
Yeah, it doesn't make it
do you feel stuff going in the back of your throat sometimes when you do it?
Yeah, like this morning. It's kind of like hairspray.
Bless your heart.
And then it makes me want to puke. But I didn't puke, but I almost did.
Well, yeah, I mean, we definitely have other options. There is one... there's one called Dulera, which is similar to Symbicort, but sometimes just a different inhaler works better for people. If I have samples of that, I could let you try it.
Is that one you have to rinse your mouth with afterward, too? Oh.
So the thing about COPD medicines and asthma medicines is that we really want to get them right into the lungs. And so far, now we do have another option. One option would be to take you off the Symbicort and put you on nebulizer treatments in the morning and night. You don't want to do that?
No.
It's just a different way to get it in. Okay. No, that's fair enough. If you don't want to do that, that's fine.
Yeah, I don't.
There is a pill that helps people who have COPD, but it's more people who are chronically coughing stuff up.
Oh.
And it's called Dalaresp, and it's something that I don't usually start on people. Usually that's a specialist. So that begs the question, if you'd like to see a lung specialist, even just for a one-time visit and just get kind of all your questions answered, we can totally do that.
Might as well.
There are the closest ones. Unfortunately, Dr. Wayne was here, and now he's moved to Des Moines. So he's still in Des Moines. He's awesome. He's very thorough. He is extremely thorough. Very good at what he does. The closest ones are in Fairfield.
Oh.
So, yeah, hopefully Tumble will get a lung doctor soon, but we don't have one right now.
All right.
Because I don't have a fabulous alternative besides the inhaler right now. I mean, the main thing that I'd like that will help you, to be honest, before anything else is
quit smoking. I know, I tried. And at least I slowed down. And I got one of those e-cigarettes.
Oh, yeah?
Yeah, but I'm not sure if that's better or not. I don't really know all of the risks. And
it doesn't have all the crud that the cigarettes have in it. It has nicotine.
It made me actually cough up a lot more than I did just smoking cigarettes. Yeah.
And when people quit smoking, they'll cough up all kinds of crud too, especially for a few months afterwards. Sort of like your body getting rid of some stuff. But I don't know why the e-cigarette would have done that more than regular for you just in that short period. But it doesn't have all the crap going into your lungs. Yes, that's true. It has the nicotine, which increases your risk for, heart disease and stuff later on.
And then have you heard of those vaporizers too? They're different than the e-cigarette. Yeah, they're different. Somehow it has vapor. I'm not sure if it's water vapor. I'm not sure if it's safe to put water vapor in your lungs like that.
I don't know.
Yeah. It's kind of new stuff,
Have you ever tried anything to help you quit smoking in the past, like patches
Wellbutrin, but I'm allergic to it. And so I don't know if Chantix is like the same as that or not.
It's not. It's a completely different medicine. We've never tried that for you, have we?
No. Chantix? I've never tried patches either.
Okay, so those are options. So what patches do